Welcome to day 2 of the National Alzheimer's Summit. We have some great discussions planned today, and I'm so glad you're joining us. I'm John Summers, the Chief Communications Officer at Us Against Alzheimer's, and today I have the privilege of speaking with Dr. Dean Ornish. Dr. Ornish is the founder of the nonprofit Preventive Medicine Research Institute in Sausalito, California. He is a clinical professor of medicine at the University of California, San Francisco, and the author of 2 books aimed at empowering people to take charge of their health through lifestyle changes. Dr. Ornish was also recently featured in a CNN special with Dr. Sanjay Gupta, where he unveiled the results of a study he and others conducted, showing that lifestyle changes can slow down and possibly even reverse the progress of dementia. Dr. Ornish joins us today to talk about that study and how the information in it can be put to use by healthcare providers and the people they see. Dr. Ornish, thank you so much for joining us today. First, can you tell us a little bit about the study?
Yes, my colleagues and I published the first randomized controlled trial showing that intensive lifestyle changes can often improve cognition and function in people who have MCI or early stage Alzheimer's disease. I think these findings are giving many people new hope and new choices that they didn't have before.
And this didn't just come out of the blue. This is something that's very similar to a study you did regarding the heart. So can you tell us a little bit more about those two and any sort of similarities that you have found between the 2 studies?
Yeah, people often say what's good for your heart is good for your brain. And it's actually bigger than that. My wife and I, Ann Ornish, co-authored a book called Undo It. And we presented a unifying theory that why is that these same lifestyle changes, a whole foods plant-based diet that's low in fat and refined carbs, moderate exercise, meditation and other yoga-based stress management techniques, and social support groups, or to reduce it to its essence, to eat well, move more, stress less, and love more. Why can these same lifestyle changes affect so many of the most common and costly chronic diseases, including both heart disease and early stage Alzheimer's? And the reason is that they're not really so different. They all share many of the same underlying biological mechanisms, things like chronic inflammation, oxidative stress, changes in the microbiome, in telomeres, in gene expression, angiogenesis, overstimulation of the sympathetic nervous system during times of chronic stress, changes in immune function, and so on. And each of these mechanisms, in turn, is directly influenced, for better and for worse, by what we eat, how we respond to stress, how much exercise we get, and how much love and support we have. And so I think our unique contribution over the last 4 decades has been using these very high-tech, expensive, state-of-the-art scientific measures to prove just how powerful these simple and low-tech and low-cost interventions can be. And because these mechanisms are so dynamic, how quickly we can often show improvement if you make big enough changes. And so beginning 4 decades ago, we showed people viewed heart disease then the way they view Alzheimer's today. In other words, back then they thought once you had heart disease, the best you could hope to accomplish was to slow down the rate at which you got worse. We showed that when people made bigger changes and a lot of things at the same time, that rather than getting worse more slowly, they actually got better and better. And so we showed for the first time that the progression of heart disease can often be reversed. And over time, that led to Medicare covering our program and making it available to the people who most need it. They created a new benefit category in 2010 to cover the same lifestyle program. And also in 4 years ago, when COVID hit, they began covering it when people do it virtually in the comfort of their own homes. And now we can reach people wherever they live. They don't have to live within driving distance of a hospital or clinic we've trained. And over the years, we found these same lifestyle changes could often reverse high blood pressure, high cholesterol, type 2 diabetes, early stage prostate cancer, a randomized trial we did with the chair of urology at UCSF, Peter Carroll, where I'm a full professor, and the then chair of urology and urologic oncology at Memorial Sloan Kettering Cancer Center in New York, Dr. Bill Fair. We found that when you change your lifestyle, it changes your gene expression. In a study we did with Craig Venter, one of the first to decode the human genome, we found that over 500 genes were changed. In effect, turning on the genes that keep us healthy and downregulating or turning off the genes that cause us to get sick, and particularly downregulating the genes that are part of this unifying theory, the ones we talked about a moment ago, that control chronic inflammation, oxidative stress, and so on. So now we have a greater biologic plausibility of understanding why these lifestyle changes can be so powerful. We did a study with Dr. Elizabeth Blackburn, the Nobel laureate, who first pioneered the discovery of telomeres, the ends of our chromosomes that regulate cellular aging. Over time, as DNA replicates, the telomeres tend to get shorter. And as our telomeres get shorter, our lives get shorter. And the risk of premature death from all of these chronic diseases that we've been mentioning, including but not limited to Alzheimer's, goes up proportionate to the degree of telomere lengthening. And Dr. Blackburn and Dr. Lissa Epple had done some pioneering studies where they found that women who were under chronic emotional stress, who had kids with autism, for example, or people who were sedentary or who smoked cigarettes or ate junk food, their telomeres got shorter faster. And we had lunch one day and I said, if bad things make your telomeres shorter, maybe good things make them longer. We found sure enough that these same lifestyle changes could increase telomerase, the enzyme that repairs and lengthens telomeres, in only 3 months, which we published in the Lancet Oncology, and over a 5-year period could actually lengthen telomeres, whereas they got shorter in the control group. This was actually the first study showing that any intervention could lengthen telomeres. And when we published this, the Lancet editors sent out a press release calling it the first study showing that lifestyle changes may reverse aging at a cellular level. So it was in that context that we designed the study to see whether these same lifestyle changes might affect the progression, slow, stop, or perhaps even reverse the progression of early stage Alzheimer's, because they share so many of the same mechanisms. That's why what's good for your heart is good for your brain. And sure enough, we found that we used 4 of the standard measures that are used in most of the FDA drug trials. The ADS-COG, the Clinical Global Impression of Change score, the Clinical Dementia Rating Sum of Boxes, and the Clinical Dementia Rating Global. And 3 of these 4 measures, we showed improvement. I should say, in all 4 measures, there were statistically significant differences. And 3 of them, and one of them was of borderline significance. If you took out an outlier, all 4 were significantly different, whereas in the control group, all 4 measures showed worsening of the disease. And if you look at one of the measures, which I think is the most clinically relevant, called the Clinical Global Impression of Change, which looks at really how Alzheimer's affects your daily function, and they also interview your spouse or caregiver, we found that 71% of the patients stopped or reversed the progression of their Alzheimer's disease in terms of improvement in cognition and function, whereas 68% of the patients in the randomized control group got worse, and none of them got better. So these findings, again, I think are really giving people hope in an area that people really need it. As you know, billions of dollars have been spent in the last 20 years to find the right drug. Only 3 have been approved in the last 20 years by the FDA. Aducanumab 3 or 4 years ago, lecanemab a year and a half ago, and more recently donanemab. And they all work by, in a sense, pulling amyloid out of your brain. And they only slow down the rate at which you get worse. And they're very expensive, up to, the newest one, donanemab, is $30,000 a person. Aducanumab was $56,000 a person, and so on, plus infusion costs and other related costs. And they have a high incidence of side effects called ARIA, including, swelling of your brain, bleeding into your brain, and so on. Now, slowing the rate of progression is good, but it's not that great because for many people it's clinically imperceptible. It's mainly in men, even though twice as many women as men get Alzheimer's, and you have these high costs and side effects. But getting worse more slowly is still getting worse. And so the suicide rate when people are diagnosed with Alzheimer's is 7 times higher than in the general population because, in a sense, they often take people's hope away. They say, I'm sorry, Mr. Jones or Ms. Smith, you've got Alzheimer's. It's only going to get worse. We can slow it down a little bit, but that's about it. Get your affairs in order. If there's anything you want to do, do it soon. You don't have a lot of time left. And so it's devastating, because when you lose your memories, you lose everything. And when you lose hope, you lose everything. I mean, I just on a personal note, I came very close to committing suicide when I was in college because I could take all the hope out of my life. I later learned that I could imbue my life with hope, just like I could take it out by doing acts of service, which is why I love doing these studies, because properly done, working with the leading scientists and physicians and as collaborators, as we've done in this study, published in a first-tier peer-reviewed journal, can redefine what's possible. And by doing so, again, we can really give people a sense of hope, not false hope. Not everybody got better in our study, but many people did. And they got better to the degree they made these lifestyle changes, which was another interesting finding. We found the more people changed, the more they adhered to this lifestyle change program, the more they improved at any age. And we also looked at some biomarkers like amyloid, like the A-beta 42/40 ratio, which is a measure of amyloid. So one of the most important biomarkers is called the A-beta 42/40 ratio, and it's a measure of amyloid in the brain. The drug trials work by, in effect, pulling amyloid out of your brain so your blood levels go up, And that's what we found in the patients in this study too. It was significantly different compared to the control group, which their levels actually went down, presumably more amyloid went into their brain. And not only that, but it was in direct proportion to the degree of lifestyle change. And I think the reason why the lifestyle changes are showing a bigger impact than the drugs is that the drugs are focusing mainly on amyloid. And amyloid is one, but not is only one of the many mechanisms that affect Alzheimer's, just as we've talked about earlier, these mechanisms that affect so many chronic diseases. So by targeting that one measure, you get some benefit. It slows it down a bit. But we also found the lifestyle changes also have the same effect on the amyloid, but also affect these other mechanisms as well. And that's why we're able to show, in many cases, improvement in cognition and function rather than just slowing down the rate at which people get worse.
Thank you. I think one thing that's important for the audience to understand and maybe get a little more insight from you on with respect to the study is I think a lot of us have known, and it's been out there, and there's lots of data to support it, that there are things that people can do in their daily lives to reduce their risk of developing Alzheimer's, dementia, or slowing down its progression. But what you're talking about, what you did in your study, is definitely more intensive, right? It wasn't just a matter of taking a 30-minute walk a day, and it wasn't just a matter of eating more fruits and vegetables. It was a more intensive program. Can you give us sort of a glimpse into that?
Yeah, that's a really good question. It's kind of like the old saying, ounce of prevention, pound of cure. And the reason why we were the first to show that lifestyle changes could often reverse the progression of so many chronic diseases is that it's really hard. You have to make really big changes to reverse a chronic disease that you've already got. And the same as we found here, we actually correlated the degree of lifestyle change that was required in our study to get to stop or improve cognition and function. It was a lot. It ranged from 74% to even a little more than 100% in one of the measures. And so if you're trying to prevent disease, you don't have to make such big changes. And I think, one of the reasons why the study has implications for prevention is that, with some of the new artificial intelligence enhanced technologies, it may be possible to predict someone who's going to get Alzheimer's, up to 10 years before it becomes clinically apparent. But until now, a lot of people would say, why would I want to know if I'm likely to get something that I can't do anything about? But if we can often improve cognition and function if people have it, it probably works even better to prevent it, and you don't probably have to make such big changes. To get reversal, we ask people to follow essentially a vegan diet: fruits, vegetables, whole grains, legumes, and soy products, minimally processed, as close as possible to what comes in nature, also low in fat and low in sugar and refined carbs. To do an hour a day of yoga and meditation, stretching, breathing, meditation, and so on. To do at least a half hour a day or an hour 3 times a week of aerobic and strength training exercise, and to participate in a support group 3 times a week. Now, that's a lot, but, unlike the drugs, which are expensive and have really bad side effects, the only side effects of these lifestyle changes are good ones. Your heart, your diabetes, your blood pressure, your weight, all these other things get better over time.
For people who have concerns about the level of intensity, because it is a very involved program, as you just described, but one that clearly seems to be effective. But for people who maybe aren't able to do that, what do you say to them? Is it all or nothing, or is something worth at least a little? What are your thoughts on that for people who may not be able to do that level of intensity?
Well, in all four decades of doing these studies, we found that the more you change, the more you improve at any age. But to get reversal of disease, it takes really big changes. Again, that's why we were the first to show that, as most people didn't go far enough. Now, a lot of it depends on your question actually kind of implies like, well, surely people can't do this. But, we have data on over 15,000 people who've been able to do this. We've actually measured outcomes on over the years. And a lot of it has to do with how you present it to someone. If you say, certainly you wouldn't be able to make lifestyle changes to this degree, and why would you want to anyway? Just take this statin for heart disease, or take this, lecanemab for Alzheimer's disease, and that'll do it. And the patient doesn't change. And they say, see, I knew you couldn't do it. But if you say to them, look, we're here to support you. That's why Medicare is covering our program since 2010, is because 93% of the people who start our program finish all 72 hours. Medicare is paying for 4 hours twice a week for 9 weeks to give people the support and the information they need to make these changes. And 93% of the people who started complete it. Now, that's unheard of. I mean, to put that in context, you would think that taking a pill like a statin to lower your cholesterol is easy and everybody will do it, and changing lifestyle is difficult, if not impossible. But it turns out that 2/3 of the people who are prescribed statins are not taking them just a couple of months later because, and they're of proven value, and they usually don't have many side effects, and usually someone else is paying for it. So why is that? And the answer is over the 4 decades, we've really learned what really motivates people to make sustainable changes in lifestyle. And it's not the way I was trained. I was trained to try to scare people, fear. Put that cheeseburger down, you're going to get a heart attack. Put that cigarette down, you're going to get lung cancer. And fear is not a sustainable motivator. I mean, for a month or so after you've had a heart attack or a diagnosis of Alzheimer's, people will do pretty much anything, but not for very long because we all know we're going to die. The mortality rate is still 100%, but we don't think about it most of the time, except when something happens. And even then, the denial comes back a month or two later. But what is sustainable is joy and love and pleasure and feeling good. And because these biological mechanisms that we talked about earlier are so dynamic, people think that small gradual changes are easy and big rapid changes are hard. But sometimes it's actually the other way around. Because when you make big changes, you feel so much better so quickly. Like in the case of someone with heart disease, their chest pain may go away. Or in the case of someone with Alzheimer's, within 12 weeks or so, or 14, 16 weeks, they start to remember things. Oh, I can read a book again. I used to forget the plot. I couldn't watch a movie. I couldn't, keep track of the characters. Now I can do that. I couldn't do my checkbook at home. A CFO, couldn't even do his own checkbook. Now he's able to do that. Or it took him a month to read a book. Now he can do one in 2 or 3 days. And so for many people, there are choices worth making, not to prevent something bad from happening years down the road, which is hard to stay motivated for, but that what you gain is so much more than what you give up. And people say things like, I like eating junk food, but not that much because I like not having chest pain. If they have heart disease, I can make love with my spouse. I can play with my kids. I can go back to work. I can do all the things that I couldn't do before. So the choices are worth making, not just to prevent something bad, but because what you gain is so much more than what you give up and how quickly that can occur.
Thank you. One of the things that I noticed is that it was a smaller group in this study, right? About 24 people who you had participate in the study, but a lot of them were Caucasian. So I wanted to find out from you what the thinking was behind that. Was it difficult recruiting people of color to become part of this? Because as you know, Black and Latino people in particular are really hit hard by this disease. So I'd love to hear more about what you're doing in terms of increasing the representation of Black and Latino people as this study continues, if it's continuing.
Yeah, no, it's an important question. First of all, it wasn't 24, it was over 4 dozen. We had 51 people in the study. And there's two aspects. One is the efficacy and the other is the generalizability. So let's talk about both, but let's start with your question, which is really the generalizability. We put a lot of effort into recruiting a diverse group of people as possible. We talked with a number of African-American neurologists and neurosurgeons. We went to barbershops. We had direct mail campaigns. We did everything we could, but we didn't get as many as we hoped. It's just unfortunate. And in fact, we didn't get as many total participants as we hoped, in part because COVID happened in the middle of the study, in part because the pharma companies are also recruiting the same patients who have early stage Alzheimer's because they know that's where you're most likely to show improvement. But they'll pay up to $50,000 for every patient who enrolls. We can't do that. So we ended up with fewer patients. On the other hand, from an efficacy standpoint, if you show statistically significant differences in a smaller group of people, it's equally valid. In fact, in some ways, it just shows that your intervention is that much more potent to be able to detect a statistically significant difference in a smaller sample. By analogy, if you were looking at the effects of penicillin on pneumococcal pneumonia back in 1950, before there was drug resistance, and you had 51 patients, and half of them you gave penicillin and half of them you didn't, you don't need 1,000 people to know that it's actually working.
A big part of our audience that's watching today are healthcare providers. How can they take the information that you've learned, what you're sharing with us today, and apply it to their own practice as they work with individuals?
Yeah, well, just spending a few minutes with people and letting them know that this is worth doing can give people a sense of hope. Hope is powerful. You know, when you take someone's hope away, which is often the case, if you tell people it's only going to get worse, it almost becomes self-fulfilling in a way. I mean, your world starts to shrink. That, I'm sorry you can't. We have to take your driver's license away, and don't go out by yourself, and all those kinds of things. And so it's almost like the brain starts to shut down as an adaptive response to such terrible news. And so I think part of the value of our program, of our study, was to give people, again, there's no guarantees, not everybody gets better, but a lot of people do to the degree they make these changes. And so I think one of the best things that a doctor can do is to give their patients a sense of hope. Our $15 Undo It book, our pmri.org, our nonprofit website, has all the information on how people can make these changes. We're also starting to make it available to people. Medicare has been covering our program, the same exact program for people with heart disease since 2010. And we're getting bigger changes in lifestyle, better clinical outcomes, bigger cost savings, better adherence, better clinical engagement than people have ever shown before. And we're already in discussions with CMS. Would they broaden the coverage to include those who have early stage Alzheimer's disease? Again, it's exactly the same program they're already covering. All they have to do is broaden the inclusion criteria. And so that process will likely take a year or so to go through what's called a national coverage determination. But we're working to try to make this available to people because we've seen what a powerful difference it can make. And even, with what Medicare is reimbursing, it's a fraction of what the drugs cost, and it works even better with only good side effects. So just as a doctor, letting people know that there is hope if they are willing to make these changes. And these are changes that many people are able to do on their own. And those who need more support, we're working to be able to try to make that financially affordable for people.
Dr. Ornish, it's an incredible study. Loved learning so much more about it and really appreciate you taking the time to join us today. So thank you so much.
Well, thank you. And it may be as drugs get better, the like with heart disease, combining the best of drugs and the best of lifestyle may give people the most powerful impact. To me, awareness is the first step in healing. And I so appreciate the chance to raise awareness and let people know that they often have choices that they might not have had before.
Absolutely. Well, thank you again for being with us today. Really appreciate it.
Thank you.